You know, getting accurate empirical data for any sort of survey, whether it's a political poll or a census or a survey about mental health issues in the LGBT community, well, it's a challenge. With us right now is someone who's trying to meet that challenge, Leslie Ewing of the Pacific Center. Welcome, Leslie.
Hi.
It's always nice having you back on the show.
Yeah.
Do you ever get tired? My goodness, you work with a lot of good causes.
It's really awful to have to stand on that corner with the clipboard gathering data. You're right. I'm over that. We don't do it that
Clipboard,
way.
you're dating yourself.
Oh,
now
no.
people would say with an iPad. So
yeah. No, we don't do that.
So now tell me first of all in general terms about the work of the Pacific Center, which is based in Berkeley, correct? Mm-hmm. And this new study you've done about mental health issues within the LGBT community.
Well, Pacific Center is the third oldest LGBT center in the country. Founded in 1973, and we've always provided mental health services of one sort or another. We have a clinic, a sliding scale clinic, that serves about 350 to 500 unduplicated folks in a year, depending on how many interns we have. And then we also have peer groups. We currently have 16 peer groups. And last year, over 600 people attended our peer groups. And then we have an after-school youth program and an HIV support counseling program. About 2,000 people all told use our facility or come to us for services.
Mm-hmm. So part of what the Pacific Center has always done is about mental health.
Mm-hmm.
But there's not a lot of data there about what does that mean? I mean, I said in the lead-in, and this is based on work I did with the Mental Health Association of San Francisco, that 1 in 4 Americans are quote-unquote impacted by mental illness. How does that translate to the gay community?
Well, those numbers are much higher within the gay community, especially within the subsets of the gay community that are the most isolated, youth and elders. And what's interesting is that we were given 4 grants from Alameda County Behavioral Health Care Services, and they recognized that there was a need that was unmet. And another thing is happening across the country, but also on a statewide level. For the first time, quote-unquote LGBTQ is being recognized as an at-risk population that resources need to be directed towards. And that is a very big change. I mean, that it's not something that's going to get the kind of headlines that marriage equality or something else would, but it really is going to have a trickle-down effect that's going to really help people who are in very much need. Anyway, these 4 grants enabled us to make suggestions to how Alameda County providers work with folks like me or you, and then the other grants were around training, around how to set up training modules for agencies and individuals who are working with folks. And then there was another one that was around how organizations can take a peer group program and really make it something more as far as providing mental health supports.
You know, I have to admit, hearing you say that phrase, the LGBT community and an at-risk group, I had this kind of reaction. I think, you know, it throws me back 30 years when we were first said, oh, you're at risk for HIV, AIDS. Should we be happy that we've been now considered an at-risk group for mental illness? Well, I mean, I'm being kind of flip, but you know what I mean.
Yeah. Well, it's creepy.
Yeah, it's creepy.
And that's probably just my jargon. You know, don't put too much on that. But the bottom line is that sometimes you have to throw resources at a problem to find solutions, and when you're dealing with government at any level, they want to know how many people. They want to know, and they want to know what the goals are, the activities and the outcomes. You have to learn their jargon too.
Right.
And data is what's driving all this. And it's interesting because within the community, I say the community, and there's no one such thing as the community.
No, I understand.
But there's one of the things that we discovered, or not discovered, but really, you know, we're able to get data on is how much skepticism there is out there towards the mental health field.
From the gay community?
Yes.
Well, because, I mean, wasn't it until 1976 that, you know, we were considered disordered if you were openly gay?
Yes.
So there's a...
Well, there's good reason.
Well, yeah, I mean, there's a heritage there of a lot of mental health professionals treating people for being gay just because they were gay.
That's how Pacific Center started. Was in a I wasn't there, but in fact, Carol Migden was the first ED at Pacific Center. Just as an aside.
Former state senator,
Yep.
former supervisor here in San Francisco, right?
Anyway, that's how the places like Pacific Center started, was because of that situation. But today, there's almost a 180-degree turn in attitude as far as our organizations are concerned, because we know that if we can gather data and present the case, there's a good chance that we will get our fair share of funding. Not more, not less,
But fair
the
share.
fair share.
And now that you've got this data, you can say this is what our fair share should be. Okay, so the study has just recently been completed. What did you learn about us?
Well, what we learned was there is no community, quote unquote. The template that is always used, like for training of a big room and everybody, getting points for it, doesn't work in smaller organizations. And that the biggest thing, whether it be for people who are clients or people who are providing the services, was that the biggest challenge is to make everyone feel safe. And for people who haven't worked with LGBT folks before, we have to, when we're doing training, we have to provide an atmosphere where they feel safe to raise their hand to ask the question that might out them as being prejudiced or something like that. It's a two-way deal. It wasn't, there were no, what we found is that there are no enemies.
Right. So it wasn't just all about, hi, I'm a member of the LGBT community and I have this mental health need. It was also about mental health providers or mental health solution providers outing themselves and going through their own exploration, correct?
A little bit. And it's been very interesting to work with the county and have some of perhaps my preconceptions displaced. I've found that people are very, very anxious to move this forward and to make and have better outcomes for everybody.
So what were some of your preconceptions that got misplaced?
Well, mostly that people didn't care. That people
When
are
you say
more,
people, you mean the government or
yeah,
mental health
government in
professionals?
general, and even providers and bureaucrats running these agencies. That I have a lot of privilege because I'm white and I'm a woman. But I also realize how marginalized my friends are if they don't present, in a certain way.
Right.
And that was a prejudice that I carried that isn't necessarily true today.
Well, it may not actually serve your clients if you hold to it.
Well, absolutely. Well, but fortunately, I don't have to. Our clients don't have to deal with me.
Right, right. I wouldn't say that. But you said something earlier in the interview that I want to go back to about how the norm, quote unquote, is that 1 in 4 people in the United States deal with some sort of mental illness. Either they themselves suffer from schizophrenia, depression, mental illness, or they have a family member who does. You said that's much higher for the LGBT community. How much higher?
I don't know. I mean, I didn't come prepared with stats, to be
Yeah.
honest with you. But I do also know from our experience at Pacific Center that people do come in with a lot of just everyday traumas and, things that happen to them that happen to everybody.
Right.
They come in because there's a breakup. They come in because they've moved here, they can't make friends. I mean, there's more commonality than what we think. Where the numbers really spike is around suicide numbers, especially around younger people.
Right. Well, I wanted to get to that. I mean, at what point is suicide considered a mental illness? How do you know someone is dealing with that until they actually make the attempt? How do you?
Well, I think people do drop hints that a professional can pick up on, and that actually is something that is a topic that is addressed primarily through our peer groups, because a lot of those feelings come from a place of isolation. And it's interesting, I came to Pacific Center in 2008 and we had 3 peer groups. And we have 15 or 16. And when I came there in the beginning, people would say, "Well, I meet people on the internet. All right, you know, I don't need that." But there has been a resurgence in people wanting to face to face,
Right.
and come into you know, with thinking about one thing and be asked another question they weren't thinking about beforehand, and that interaction, that spontaneity, and that's actually one of the things that came out of our work with Alameda County Innovations projects. Was we did a module around peer groups, or what they call supports, and how peer groups really are a tool for prevention and early intervention for people who need a little support, but maybe can't take that step, and maybe, you know, therapy isn't really what they need.
You know, talking about mental illness or any mental health issue has always seemed to have some sort of stigma attached to it. I know when the work we were doing with the Mental Health Association was specifically around removing stigma and treating it as any other health issue, something to be treated or dealt with or talked about. Do you find in your work and your colleagues, I guess if you can speak for them, that the stigma is the same or worse for members of the LGBT community dealing with mental illness? Is it like do you have to come out of the closet doubly?
Well, that is an issue, especially if you're going into a mainstream therapy setting, and is one of the things that people tell us when they come to Pacific Center, is that coming to a place that is LGBTQ friendly, or in our case, mission driven, eliminates one very big barrier. That they don't have to go through the whole coming out story, or explaining their gender identification choices and all that. It's okay.
Right, right. We've got just a few moments left. Talk to me about what you think is the most important aspect of the survey. What is the thing that you think is going to have the biggest impact on maybe increasing funding, but also increasing awareness around an issue for the LGBT community and mental health issues?
Well, there were 14 grantees that worked on projects and were given different assignments, so to speak. One was a group of people, communities of faith, Asian Pacific Islander people, you know, all the way across. And all of these groups created curriculum, training, materials, videos, that type of thing. We created a very extensive training module that anyone could use nationwide. All of that will go up on the Alameda County Innovations website, and it's all in public domain. So it's accessible to anybody who wants to use these materials. For us, we also belong to an association called Centerlink, which is an association of 125 LGBT centers across the country, and all these materials will be spread out to them also. So you can see the impact right there. And already we're working with a brand new LGBTQ community center in Fairfield. And they've been coming to our trainings to set up peer groups and that type of thing. And we've just started a senior support group in Livermore.
So already it's beginning to have an impact.
Yeah, already.
Well, hopefully we'll have you back to talk about the good things coming out of that survey. Always a pleasure having you on, Leslie.
Very nice to me. Thank you.
Thanks so much. Next up, our conversation with Frances Wallace, director of Frameline, the oldest and the biggest LGBTQ cultural event on the entire planet. We'll be right back.